I've heard over the course of the last while some concerns from a number of healthcare workers about not being part of the Phase 2 sequencing, and as you know, many healthcare workers are included in Phase 1, and our officials are now working on any revisions that may be necessary to potentially include some additional categories of healthcare workers in Phase 1. What we've asked the Ministry of Health to have another reevaluation of is there other groups of folks in the healthcare sector that would be at high risk of coming in constant contact with COVID patients. Is there other groups that maybe we could include and pull forward into that Phase 1 vaccine access? But in saying that, it isn't going to be all of the groups across the healthcare sector. There are going to be a number of folks in the healthcare sector that are going to be under the mass vaccination age priority, but we want to have another reevaluation as to, have we ensured, all of those that should have access to a vaccine here very early. We want to provide that access. The fact of the matter is that not all healthcare workers in our public healthcare system are going to have priority access to this vaccine. I understand why the request is there, and Dr. Shahab had spoken to the risk of exposure earlier. There is a risk of exposure that varies across our healthcare system. That's one of the factors that needs to be taken into account. There also is the risk of a negative outcome when you do contract COVID-19, and that is age. Yes, some small groups that have some ailments, but predominantly age, and Dr. Shahab had the charts here that show that. And we need to balance that risk of exposure with the risk of a negative outcome with the capacity of us being able to deliver the numbers of vaccines that we are expecting to receive from the federal government. We're trying to do that as best we can and to keep people safe and to ensure that we are, as quickly as possible, yes, making the vaccine available, but making it available to people that could have a very negative outcome, and also then balancing that with the integrity of our healthcare system.